During the physical assessment, you will use all your senses and a systematic approach to collect information about your patient's health. During this video, we will learn how to take a pulse. The patient's pulse reflects the amount of blood ejected with each contraction of the left ventricle. This is frequently referred to as the heartbeat. The pulse may be counted as beats per minute or noted, for example, as a pulse rate of 80. On adults, the radial pulse is generally assessed on responsive patients and carotid artery for unresponsive patients. To palpate for a pulse, use the pad of your index and middle fingers. Press the area over the artery. Press down with some pressure and slowly release until you feel the pulse. If the pulse is regular, count the pulsation or beats for 30 seconds and then multiply by 2 to get the number of beats per minute. Normal pulse range for an adult is 60 to 100 beats per minute. It is important to record the quality of the pulse. This is characterized as the strength. A normal pulse is easy to palpate. A weak or thready pulse is hard to feel. A bounding pulse is a forceful or strong pulsation. An absent pulse is not palpable. Also assess whether the rhythm is regular or irregular. If the rhythm is irregular, difficult to palpate, or very slow, count the beats for a full minute. Avoid using your thumb to assess a patient's pulse because the thumb has a strong pulse of its own. You will need a watch. Remember to record which side, left or right, was assessed. If you need to palpate the carotid arteries, avoid excessive pressure. Too much pressure may cause your patient to pass out or decrease circulation to the brain. Remember to never palpate both carotid pulses at the same time. Palpating both at the same time may impair blood flow and perfusion of the brain.